Hello, Angie. Good to talk to you again.
Hi, Matthew. Yeah, nice to see you again at the beach again.
Indeed, yes, this is a picture courtesy of Hiroshi Nagai, the Japanese David Hockney,
Mm,
who did a lot of album covers for Japanese city pop albums in the 70s and 80s, I think.
mm. It's why it makes me feel chilled looking at
Yes.
it.
So let's
I
talk
can
about
feel.
cancer. That's fun and chilled and cheery.
Yeah, that's exactly what I want to do it this thing in the morning. Um, well, I I asked about um I asked about what I could ask you.
Mm.
Um, not imaginative enough myself, and I maybe won't ask the most relevant questions, but um. Ellen Alini, who I believe knows you, has um, asked about in addition to the standard of care, there are so many alternative or additional treatments for cancer. How do you find out about them, and how do you decide which are worth trying?
That is a good question. So first of all, I should very briefly say like what SOC is, so standard of care. I don't know why they call it standard of care and not standard care or something. So SOC, standard of care, means kind of best practice. I don't know if it's for all diseases or just for cancer. But it's basically means following the guidelines of the health system of your country. And it sort of maybe makes sense for early stage cancers, but it definitely doesn't make sense for late stage cancers because standard of care does not have a happy ending. Like currently best practice for most late stage cancers ends with the demise of the patient. And yeah, so it's not very good. And it's based on data, but the data is quite old and quite unreliable. So typically it will be based on 5-year survival data. So they'll look at, they'll give patients a certain type of chemotherapy and they'll look at comparing, I don't know, chemotherapy plus surgery versus surgery alone versus chemotherapy alone. And they'll see what percentage of patients survive for 5 years, or what MOS, median overall survival, what like the average, how long does the average patient live? So potentially for early stage cancers, you could maybe argue that it's worth just following the doctor's orders. However, even for early stage, many cancers do tend to recur with standard treatment. So I think it's hard even for early stage to justify following what the oncologist recommends. So there are lots of treatments. I mean, there are treatments that are tried and tested, part of standard of care. There are treatments that are being trialed, and those that are being trialed now won't be available for many years. It takes years and years and years to prove the treatment because you have to do a lot of follow-up.
Yeah.
If the treatment's good, then the patients in the trial live a long time, which is fantastic,
Yeah.
but you do need to do a lot of follow-up.
Well, you need all that time to have passed to know that that's the case, I
Exactly,
suppose.
yeah. And as treatments improve, you're going to need to do more and more rigorous follow-up to make sure that the newer treatments are considerably better than the old ones, particularly if they're a lot more expensive. So there's so you could access trial treatments. You could look at treatments that have been approved for one type of cancer, but that could work for your type of cancer, but just haven't been trialed yet. So some treatments seem to be cancer agnostic, so they probably work for several different kinds of cancer. Treatments for head and neck cancers tend to be trialed early because unfortunately those patients don't have many good treatments available. So, for example, I think it was last year, a big head and neck cancer trial was published. There was a treatment that I've had in Japan, and that was using part of the cancer tumor, in my case removed from liver, and using that to condition some immune cells, in this case taken from my own blood. And this is called lysis primed dendritic cell therapy. So lysis just means like mashing up some tissue.
Okay.
So they mash up the tissue, and then you essentially use that tumor tissue to train your white blood cells to go out and find the cancer. So when I had that treatment a few years ago, there had been no kind of big, robust trial. This head and neck cancer one was the first. Now, there's no reason to think that this treatment would be uniquely good for, in this case, for type of brain cancer. It's just they chose those patients because those patients have very few options. And the trial results were fantastic. It doubled the overall life expectancy of the patients, which is a really good result.
Are you saying that you would specifically look up trials for those cancers? And
yeah, exactly. And particularly look at the trials from a few years back, right? Because those are the ones that may start to become the treatments may start to become available in the next few years. So it's this kind of weird thing that when you hear about a trial or a new treatment in the media, typically it's years and years and years away. So you have to know a bit about how the trials work. Is it a controlled trial, which means they have some kind of control group? So they have a group of patients who are getting standard of care, and then a group of patients who are getting, so for cancer, it would generally be standard of care plus some other treatment. Whereas for other diseases, the control group gets no treatment at all. Right. So if you're trialing a cold sore remedy, you have, 600 people, and 300 of them get the new cold sore medicine, and probably 300 of them get a inert paste that they put on their lips. And if it's a double-blind trial, then the patients don't know whether they're getting the real medicine or the placebo, and nor do the staff doing the trial. And that's to kind of get rid of any biases. It's one thing we should be acutely concerned of, is like avoiding these biases, because they muck up the results. So, Ellen's question's got like two parts. One is like, how do you find out about these treatments? And the other one's like, how do you choose them? So a good way to find out about them is every single time you meet your oncologist, say, are there any trials going on at this hospital or any other hospital you know about that may be relevant to me? Or have you read any papers this month that may be relevant to me? Because oncologists will read journals like Nature, was a New England Journal of Oncology, this kind of thing. So they're reading these journals and hearing about these treatments. For cancer patients, if we're desperate, any trial is probably better than no trial. So even if it's one of these really early stage trials where they're just seeing if the medicine's kind of safe, it's maybe worth joining. If a trial produces good early results, then everyone gets the drug afterwards, right? Because there's like an ethical point where, if the treatment group, all suddenly can play the piano or whatever, or whatever, it makes sense to then, ethically, you have to give that to the placebo group.
Yeah.
In the trial I mentioned, that trial involved surgery, and therefore every patient in the control group automatically got the treatment later on anyway. Now, it happened to be the results were really good, but even if there were no good early results, they would have been given the treatment. So this is called a crossover trial. So some trials where the treatment's kind of invasive, they'll do a crossover trial where at a certain point, the control group are automatically given the treatment as well, just because even being in the control group is quite a big deal, because in this case they did surgery. So, you know, they did surgery on, I think it's 150 patients. 75 of them started receiving the treatment straight away. The other 75 were observed. And after, you know, whatever it was, 90 days, the control group were given the treatment anyway. And yeah, the results are kind of fantastic. And I'm very pleased that the trial happened, but also I was kind of thinking, like, this is kind of old news for me because I had this treatment a few years ago. It's been done in Japan for quite a few years already with very good results. So yeah, finding out about trials is very important. There are a whole bunch of trial finder websites. You can go online. The US Institute of Health, NIH, National Institute of Health, their trial database lists almost all trials going on in the world. I think not limited even to English speaking countries. So like you can go and you could go, if you're in the UK, you could look at the NHS trial database, but all those trials will also be listed in the US one.
Right. Okay.
Trials can have quite strict criteria. And unfortunately, so one set of criteria is like your physical health. You have to have a certain minimum level of health to be able to do it. Another set of criteria is about past treatments, because often trials are a combination of treatments, and they usually don't want people who have already had one of the treatments in the combination because it may skew the results. So that's very unfortunate. If you've survived a long time and had a lot of treatments like me, you then find that trials that could potentially help you are not welcoming to you because you're rejected on the basis of that treatment. Okay, so that's trials. You can find out about trials
through your oncologist and
through online databases, through talking to other patients in online groups, Facebook groups. Most of the big cancer charities or non-government organizations have some kind of cancer forums for patients, so you can look in those. You can search on Twitter for just, if you have stage 3 ovarian cancer, you could search on Twitter for stage 3 ovarian cancer trial and see if someone's mentioning that, they're just about to join a trial. Trials generally recruit for several months. So if someone writes on Twitter that they're just about to join a trial, there may still be time for you to join, right? So it's not like finding a cheap flight online where someone mentions it and that means you're far too late. It's not like that at all. So there's that. There's I think a lot of people are interested in off-label drug use. So that's where a medicine seems to be helpful for one thing, even though the medicine was designed for something else. And there are many famous examples. I mean, aspirin seems to be useful for a whole bunch of things. So aspirin is a painkiller, and one of the side effects is it thins your blood. That's not good if you are a sword fighter and get cut all the time, but it's very good if you have some kind of medical condition that thickens your blood, putting you at risk of a stroke or heart attack. So that would be an off-label use, right? So aspirin is prescribed now for lots of different things, and some people take half a tablet of aspirin every day just because they believe it may contribute to general health. Another very famous example is the angina medicine. So the medicine was developed for angina, which is kind of a heart condition. It is also developed for high blood pressure, hypertension. And in the trials, the male participants had a certain side effect I'm not going to go into. And the drug company thought, people would probably pay a lot of money for this side effect. And that drug is Viagra. So Viagra was not particularly good for heart conditions and high blood pressure, but the side effect in many of the
It was
male
useful in other ways, people.
exactly. So a famous example for the cancer patients at the moment is metformin. That's a diabetes drug for people with type 2 diabetes. So this it's a drug that lowers your blood sugar a bit, and at low doses it seems to help for some cancers. So I take metformin because it's very cheap. In my case, doesn't seem to have any side effects, and it makes my immunotherapist happy when I take it, I think. Some trials have shown it's not effective for certain cancers. So recently there's a trial published for, I think it was stage 3 breast cancer, and they found no benefit. But yeah, there's a lot of excitement about off-label drug use. But I think if it has side effects or if it's expensive, you need to really think carefully about, is it worthwhile? Because some of the effects may be minimal or zero. You also need to check with your oncologist, which can be a bit difficult to do if they're kind of very focused on the standard of care. The reason you need to check with your oncologist is that some of these off-label drugs may interrupt your metabolism, and your metabolism is what breaks down chemotherapy and stops it poisoning you. It can also be what makes the chemotherapy. So certain drugs you're given as a prodrug. So I take a drug called TS1, and my liver turns that into the drug that attacks the cancer. So if you are taking a handful of pills every day because some idiot on Facebook claims that these are good for your cancer, then it may be stopping your normal treatments from working. Another reason why I'm kind of not I'm not bullish on this. I know it's bullish when you support side. I don't know when the financial people talk about being bullish on something, is that they're enthusiastic about it?
I'm not sure. I've kind of only heard it. If you're bullish, if you're going all in, and
yes. So another reason I'm not bullish on these is because if you are taking a bunch of these drugs, and I mean many cancer patients I've seen in Facebook groups are taking like 12 tablets a day that they've read about in various groups. You put yourself in a very difficult position when you get side effects, because if you get side effects from your chemotherapy and you say to your oncologist, I'm getting these terrible side effects, what can I do? When your oncologist finds out that you're popping 14 extra pills a day that you read about on the web and you've bought from some slightly shady online store, your oncologist can quite sensibly say it's likely to be one of those drugs you self-prescribed yourself. Another thing about these drugs is when you're buying them, you're typically not getting what you think. Okay, so this is this has been proven. Absolutely, this has been proven. It's been repeatedly proven. So every few years, like various TV, like consumer TV shows, they'll do this thing where they buy a load of pills online, and they'll take them to the lab, and they'll say like, oh, this pill claims to be some Chinese mushroom supplement, and we've run it through the spectrometer and found it contains, chalk, sugar, a little bit of caffeine, and no sign of anything that you could possibly find in a Chinese mushroom. So these happen repeatedly. Occasionally, the US go to Mexico and raid like cancer clinics and various other clinics that claim to be doing immunotherapy, whatever. And they often find that the drips are just saline drips, are just salt water. So all these patients saying like, oh, I went to Mexico and I got this cutting edge cancer treatment and now I'm fine. They are, I don't want to say they're lying, but they're very mistaken, because most of them would just be getting, a salt drip for $5,000 or whatever. And this is all well documented. This is not my opinion. This is all well documented. You can go on Google and look for FDA raids. FDA is the Food and Drug Administration. So I'm very skeptical about those. I'm particularly skeptical about the idea of taking lots of tablets at once, because from talking to doctors, it seems that it's quite likely your liver will just work harder to break all this stuff down, and it will just go out through your urine anyway before it's had any time to work. Yeah. So you'll often hear like people will make claims online that there's just no reality to them at all.
So whilst you're looking in forums for things that will work, anything where you've got to source it, the drugs yourselves would be
you'd if possible, you want to find a cooperative pharmacologist who will source it properly for you. In some cases, your oncologist may be able to prescribe this stuff. It depends on it may depend on the health policy of the hospital. They may need to clear it with an ethics committee, particularly if it's a teaching hospital. And that can take ages, but it may be possible to get this stuff from your doctor. Particularly, if it's an old safe drug, your doctor may be the right, like, or the patient looks like they may be pre-diabetic, so we're going to give them some metformin. So your doctors may be able to bend the rules slightly. So it is difficult to get through the minefield when you're desperate to live. In everyday life, we'd say that looking at the messenger is a logical fallacy, right? So just because a stupid person says something doesn't mean that thing's untrue. In the case of people recommending cancer treatments, especially unproven cancer treatments, I think we have to look at the messenger sometimes. If some guy is claiming that he cured his cancer with dog dewormer, we might want to look at him. Is he making money out of promoting this? Does he have a credible story? So, if he says, oh, I cured my cancer with dog dewormer, I was, of course, doing chemotherapy and immunotherapy, but I don't think those work. We should be a bit skeptical. Now, Eleanor knows I'm talking about a real person. I forget his name, fortunately, but yeah, so there's some idiot promoting dog dewormer as a cancer treatment, and he was in an immunotherapy trial for Keytruda, I believe, which is a checkpoint inhibitor. And he points out that most people in trial didn't get any result, but actually only about 10% of colon cancer patients would get a result from this drug anyway. so presumably he was in that 10%. I mean, and that's the whole point of the trial, is some people get a response and some people don't. So yeah, I think, you know, we do have to kind of look at where the message is coming from. Are they making money somehow? Are they trying to sell you into a course? Have they got an ebook to sell you about, like, eat your way to a cancer cure? You know, are they selling green smoothie mix? It's like, yeah. So another thing is there a credible mechanism? So again, usually in science, we look at correlation and cause, and data shows correlation between things, and cause comes from understanding the mechanism. So if there's not much evidence available, but there's a credible a credible kind of known mechanism, then it may be worth taking the treatment, right? There may be a good reason why the data is not available. I mean, in the trial I told you about for autologous lyset pulsed dendritic cell therapy, it's very difficult to get a whole bunch of similar patients to do this treatment with, because you have to do surgery as part of the treatment. In my case, I was having the surgery anyway, just arranged with the surgeon to freeze some of the tumor tissue, and it was a straightforward thing. You can't generally go and cut people open just for some experimental treatment. So there may be good reasons why data is not available. So yeah, I hope that's a reasonably useful answer. So I would look into trials, particularly look into trials from a few years ago. I would, if you hear about a treatment that seems to work but is not available to you, it's worth contacting the drug company directly, because every single drug company has some kind of program to give treatment for free. So sometimes this is part of what's called a stage 4 trial, or post-marketing surveillance, where they just want some more case studies to see, you know, out in the real world, once the drugs are approved, you know, if it's approved in a very narrow category, there might not be many patients taking it. And if, you know, if they can get more data, then they might get a wider market. So that's sometimes an option. Some of them will provide it just on compassionate grounds as well, particularly to late stage patients. So contacting the drug companies directly and saying, you know, I know you're offering this drug in the US, it's not approved in the UK yet. Do you have a compassionate program that would allow me to access this drug or whatever? And then online stuff, yeah, talking to other patients, trying to find patients who have a very similar situation to you. Be very wary of people promoting treatments. So, you know, I'm very biased towards autologous adoptive cell immunotherapy because it saved my life. I never, ever do anything to promote it. I'll help people access the treatment if they come to me, but I won't promote it because it may not be suitable for them. There may be many reasons why they shouldn't have it. They may have an autoimmune condition that would, you know, potentially be fatal if they had a big influx of immune cells. So if people are promoting treatments, we have to kind of ask why. There may be conspiracy theory people. They're quite easy to recognize sometimes. Many of them may be in a multi-level marketing scheme, like a pyramid scheme. So generally people promoting supplements in like cancer Facebook groups and stuff, they'll sort of promote the treatment, and then you contact them for more details, and they'll say, oh, the really good news is you can make money while doing this treatment, Angie. Just sell it to your friends. So yes, I hope that is a useful and practical answer to the question.
I feel like there's quite a list of things that you want to have sort of, okay, when every time you're looking into something, to check your whether it
absolutely, like you know, does it smell right? Like, is this person promoting it too strongly? Do they have some kind of agenda?
What are the red flags to look for?
Yeah, exactly. I mean, an obvious one is if you're in a online group and someone's promoting a treatment, look at their profile. If it says independent distributor for blah blah blah, or consultant for blah blah blah, it usually means they're in a multi-level marketing thing, and they're making money. You know, are they trying to sell an ebook? Do they have a course on cancer cookery? Or yes, so I think we should be skeptical, but we should do everything we can to access new treatments. Okay, I know you have a deadline today.
I do. I'm gonna have to remove myself fairly soon, but
Yes.
Eleanor, I actually have another question for you. A bonus question. Sorry?
Another cancer question?
A non-cancer question. As there are other things that she she thought you would like to talk about. So if this is about sort of, so you're living in Japan, and is there something that you would like to import from British culture to Japan, and something that you'd like to ship to us back in the UK from Japan?
I think going from Japan to the UK is kind of easy because it's so superior, the life here. So in Japan, there's kind of a culture of doing things well, almost for the sake of doing things well. So things are like built very well. Like things here are built to last. People take a lot of care in taking care of things, for example. I mean, you know, Japan is famously very, very clean. But it's also, you know, if something breaks, it's repaired very quickly. To the extent that when you're on a train and it stops in a station, people may get on and replace the light bulbs in the minute that it's, you know, there, or they may ride the train to the next station while replacing a, you know, fluorescent light or nowadays an LED light. Things like that. You know, they're very strict, very self-disciplined, I guess, on doing things well and doing it well the first time. Whereas where I'm from, the UK, there's very much a culture of like, yeah, how long can you get away with doing things badly? You know, an obvious example would be, so when I first came to Japan, just for a year, it was end of 2001, the main telecoms provider here, NTT, equivalent to BT in the UK, they just put fiber optic everywhere. They just everywhere they could just rolled out fiber optic. At presumably huge cost. And for this reason, we have super fast, super cheap internet and have had for 20 something years. Whereas in the UK, it's always like, well, can we push copper a bit longer? And, you know, can we get away with our Edwardian cabling in London or wherever? So you can have these bizarre situations where, you know, you're on the same street as the telephone exchange or central office, as the US would say, but you're told you can't get fast broadband because there's too much copper wire between you and the phone exchange because it's going on some bizarre route and it's all from the 1930s and can't be replaced cheaply or whatever. Yeah, this kind of weird stuff. When, as in Japan, it's just like, let's do things right the first time. So, you know, buildings here, they don't kind of scrimp and save on everything. Like they'll put in high quality components. I mean, this is a very topical thing because in the UK, it's recently been discovered that there's all this so-called reinforced aerated baked concrete, which is not reinforced at all. and it fails without warning. So loads of it's been used in roofs for public buildings, hospitals, schools and things, and potentially it can collapse any time. And most of it was put in the 80s and 90s, and now is about the time when it dramatically fails, and possibly it's going to kill some people, which is very unfortunate. We had was it year before last, the Grenfell tragedy in London, where a dangerous building cladding was used that had an uncanny ability to spread fire around the outside of a building, essentially providing a perfect shortcut for fire. So yeah, that's something I'd really like to instill, like a deep culture of doing things well, just for the sake of doing things well, not because it makes economic sense, which it sometimes does and sometimes doesn't, but just for the sake of wanting to do things well.
So you'd export from Japan pride in workmanship.
Yes. And from the UK, I would import sarcasm. I think that's the thing I miss most.
Didn't you do that when you moved?
Yes, my one man sarcasm army. Yeah, sarcasm. I mean, I don't know, it is a double-edged sword, isn't it? But yes, sarcasm, the British sense of humor, I miss a lot. That kind of, yeah, I guess that's cynicism, although the Japanese enthusiasm for stuff is also kind of amazing. You know, if you tell someone in the UK you're going to do something, you know, first of all, they'll explain why it's a stupid idea and you wouldn't succeed anyway. Secondly, they'll explain how they did it already. And thirdly, they'll complain that it doesn't, you know, peel potatoes or whatever. Whereas in the Japan, people are just like, oh, that sounds great. And, you know, they're just enthusiastic about things in a way that is really nice. Yes.
That's a positive thing to be surrounded by.
So yes, that's what I do. I would take British sarcasm, and in exchange, the good people of the UK can have buildings that don't fall down and randomly catch fire. Yes. Just if there's just time for a 30-second anecdote. In my hometown in the UK, it was time to replace the market. We have a nice covered market, and they said, let's redo it, and let's make sure it lasts 50 years. So, you know, they sourced the components and the materials and things, and they're very proud to say that they used the same shutters on these market stalls that were used for the Millennium Dome. Of course, later it was pointed out the Millennium Dome was designed to have a 10-year lifespan, and these shutters were therefore designed to fail around 15 years. And this is just like a typical British thing. You know, a similar one was when the local council or several local councils in Norfolk thought it would be a good idea to replace the wooden window frames of all the council buildings with UPVC plastic ones, so you didn't have to paint them. But of course, they chose window frames that break down in sunlight, and again have like a 10-year lifespan, whereas a wooden window frame, if you can be bothered to paint it, you know, every couple of years, it's going to last hundreds of years. So yes, good quality craftsmanship is something that I would take from Japan to the UK. There's a interesting question.
It's here. It's I think it's sort of proudly standing in its corners rather than a culture that is taken on by whoever council's employing.
Good. Well, hopefully we can do another one of these sometime in the near future if there are more questions or anything people would like us to talk about that is cancer related.
Yeah, that's awesome. Right, it's really good to see you. Thanks.
Lovely to see you too. See you soon.